Hey everybody, Dr. Rob Silverman here, Amazon best-selling author of Inside Out Health and ACA Sports Council Chiropractor year 2015. I'm happy to update a whole bunch of new, exciting information on COVID-19. This weekend was an interesting weekend for me. As you guys all know, I'm in my practice right now, and a lot of people reached out to me over the weekend to talk about COVID-19 in this health pandemic. It's really simple. Many of my colleagues want to know, get some information. Other patients are going through the process. They just got positive as a positive rate increases. And others have had it months and months ago. Everybody knows that I'm in the epicenter. That epicenter is in Westchester County, or at least the epicenter where it all started. And now we have a lot of people 3, 4, 5 months post-COVID, and they just don't know what to do. So what I wanted to do was, I had 2 emails that I wanted to go over. I wrote them down here, and I want to share you their patient symptomology and what it all means. I think it's a great thing if you could share this with everybody, take some quick notes. It's a very interesting case scenario. Very simply, this particular individual is a doctor. He contracted COVID-19 2 weeks ago. He was adhering to all the protocols, and evidently his wife shared it with him, unfortunately. So his symptomology 2 weeks into COVID-19. Now, mind you, he's a healthy, 40-year-old, very fit, health-oriented individual. He still has his loss of sense and smell. So the loss of sense of smell is very common. At least a third of the people lose their sense of smell. And the reason is that really indicates that it is a true central nervous system issue, because your sense of smell goes to one of your cranial nerves in your nose. So you're already seeing that somebody has, within the COVID-19, a central nervous system compromise. He has a lot of body aches. And those body aches are really coming because there's a mitochondrial deficit within the aspects of COVID-19. Shortness of breath, that's not uncommon. There's a lot of lung issues, inability to breathe and exert yourself. And he's also taking the pulse oximetry, and he says his oxygen levels are great, even though he's having a little shortness of breath. Now, what he said was any kind of exertion. So in his house, if he walks up a flight of stairs, he has to sit and stop because he's out of breath and out of shape. So obviously he's been adversely affected. His heart rate shoots up with any exertion whatsoever. So he's a little concerned of him, maybe because these symptoms are so tough 2 weeks into it, and him being so healthy, he's afraid of being the new term called a long hauler. And those long haulers mean that you keep the symptomology for a long period of time after the infection appears to abate. He's showing symptoms of dysautonomia, and not to get too technical, but that means a issue or dysfunction in the autonomic nervous system. Now, we were able to rule that out. These are just pure symptoms of the COVID-19. And again, he can't do anything without his heart racing. And basically, he asked me, as that symptomology, hey doc, what do you do? So interesting. Obviously, he's 2 weeks into it. So number one, here are some of the supplements once you're infected or during the infection. So elderberry gets taken out once you're infected. So I'm a big elderberry fan, in that I believe elderberry is a great choice to help avoid any kind of viral infection. The literature really deems that out, especially up to 24 hours before exposure, 20 minutes from exposure. Not quite as effective. There's some arguments that elderberry isn't quite as good during infection and or autoimmune, so that wouldn't be my choice. I gave him 5 supplements that I thought would be a great choice to help him, and that was D3, 5000, and K2. That was number 1. So really a lot of good literature on how D3 really enables balancing and support, and puts your immune system at a point where you could be more resilient and ultimately possibly rejuvenate. Number 2 is nothing fancy about it, but highly effective, curcumin. Curcumin's a great choice. Curcumin is shown to decrease inflammatory pathways and increase antioxidant pathways. In addition to that, I'm big on the omega-3 fatty acids. Omega-3 fatty acids have shown a great job at enabling people to decrease their inflammation. Something that we've talked about before but isn't in the mainstream media is pro-resolving mediators, especially since it appears that his lungs have got affected. Pro-resolving mediators is really shown to decrease the alveoli, they're on the lungs. Cytokine storm, which appears he has, they do a great job. So pro-resolving mediators are also an excellent choice to take. More so than that, with your pro-resolving mediators, melatonin. Now, when you think about it, the president, we all know, contracted, and during his contraction of COVID-19, he was given zinc, which is great, good choice, vitamin D3, and melatonin. Everybody, when I say melatonin, the word association very simply is sleep, and it is great for sleep. But melatonin is the jam for any kind of cytokine storm. Melatonin is great in that it's not only helping sleep, it's also shown to decrease a lot of inflammatory markers and decrease antioxidants. So 3 to 5 grams of melatonin is that sweet spot to get it. And maybe the first day or two, if you get infected, are you guys ready? It sounds like a lot, but it really isn't 20 grams of melatonin. So that's my big 5. I also told him to be active, get as much sleep as he can, sauna if possible, get the toxins out. Intermittent fasting has shown the ability to allow your body to perform autophagy. Autophagy is the breakdown of cells or self-devouring, and with that breakdown in the energy from the cell remnants, you're able to make new cells, and that's truly immunorejuvenative. So that's also a great choice. And believe it or not, I'm a proponent. I found some exercise. I know it's tough. I gave his case scenario, and he's 2 weeks into it. I made these recommendations on Saturday, spoke to him today, this morning, and he said he feels like he's proverbially rounding the corner. Now, I have another patient of mine who had it back in April, and to this day, they're still feeling some fatigue. Their sense of smell has come back, but the biggest things that they say is that they still don't feel right. It's just they don't feel 100%. That fatigue is a problem, that gastrointestinal is a problem. And some of the things that you have to realize about this is a full body attack. COVID-19 is not just a lung. COVID-19 is not just a flu. COVID-19 actually affects the ACE2 receptor sites, as we've talked about before. And COVID-19 really affects blood vesicles and a lot of epithelial cell linings. So having said all that, for that particular individual with the fatigue, I'm big on building up and robustly building up their gut. So gut health is the epicenter of all health. It has a lot of ACE2 receptor sites. In addition, this person also could stand to lose a little weight. So with that weight loss, adipose sites, fat cells, have also been shown to have more ACE2 receptors than any other site. So they're reservoirs for viruses, so we want to get rid of them. What I've also been doing, believe it or not, is been detoxing a lot of these people 3, 4, 5, 6 months later, getting rid of the toxins. Now remember, everybody always thinks that detoxing is an environmental toxin, but since there's a gut to liver pathway and a liver to gut pathway, a lot of these toxins go to the gut and damage the gut. With that being said, you need that pathway to be clear. You need to remove all the different toxins. So I'm big on fixing the gut and the liver. My upcoming book, Superhighway to Health, has a whole section on gut to liver axis. So I want to go into a little bit more detail. One of the other things that I recommended for both, and I use it in my office all the time, is low-level laser. Low-level laser I found to be just one of the most effective, or I should really state succinctly, the most effective modality I use in my office. So interestingly enough, that when you get the SARS-CoV-2, I really want to go through the effects of the cytokine storm and lung tissue and then tell you what low-level laser does. Because I wanted to emphasize one very unique thing other than just talking about the nutrition, other than just talking about the supplements that you can take. SARS-CoV-2 affects the alveolar epithelial cells. They activate through signals. Remember, the body it's all a signal. We're one big electric signal, if you will. They activate macrophages. Those macrophages increase cytokines. Those cytokines are inflammatory markers in the body, and they increase activated T cells, neutrophils, and capillary permeability, which is actually allowing inflammatory mediators, pro-inflammatory mediators, interleukins, and all these things, all these hot, when I say hot, it's truly hot because inflammation is set afire, all these hot type inflammatory markers to get into the lung area. We're talking mostly about the lung, and damage that lung lining. And that's one of the reasons why people feel a lot of shortness of breath. Now, what's most interesting is with those alveolar cells, which we talked about, because there's a lot of ACE2 receptors in the lung, low-level laser, actually 635 nanometer, like a cornea does, 635 nanometer laser actually is shown to decrease the activation of the macrophages, and it systemically decreases inflammation in the body, but specifically at the lung level. So one of the other things, and I alluded to it before, was the weight and obesity. So I really wanted to talk about the effects of obesity on inflammatory cytokine production and ultimately leading to insulin resistance. So if you're going to go to your doctor and you ask your doctor, hey, I want to test for a few markers, one of the markers I would strongly recommend would be to see about your insulin markers and your insulin resistant markers. Now also, one of the hidden gems, I tell everybody, let's test our body fat. Because unfortunately, 72% of America is either obese or overweight. 12% of Americans only are metabolically healthy or truly metabolically active at a health promoting level. So the ideas of the effects of obesity and inflammatory cytokine production and insulin resistance, it's very simple. If you're lean, you have a lean adipose tissue, you're using your free fatty acids for energy. The saturated fat that you're consuming is a good quality saturated fats, and you have what we call proper ratios between Th1 and Th2. These are your immune cells, these are your T cells, and your macrophage 1 and your macrophage 2. Macrophage 1 is very interesting in its viruses and bacteria. Macrophage 2 has another body marker. So you want the proper amount of ratios. Now, unfortunately, when these ratios go aberrant, which usually happens in adipose tissue, once again, you're going to get inflammatory cytokines. These inflammatory cytokines will stimulate something called toll-like receptor 4. Toll-like receptor 4 is a receptor on, believe it or not, your gut and other epithelial cells, in that they stimulate inflammation going on inside specific cells. And in the cells, there's a lot of insulin receptor sites. Because of the inflammation, those insulin receptor sites, it's sort of like a Velcro, gets worn away. Insulin can't come in, and you have more circulating insulin. Insulin is very deleterious to overall effect. So obesity leads you down a path of having more cytokine production, and because of that cytokine production, i.e. one of the biggest issues in SARS-CoV-2 or COVID-19 is insulin resistance. So once again, I want to reiterate, as we said earlier, and I'll get to all the questions at some point in the future, there's protective and therapeutic effects of some tremendous macronutrients on inflammatory, thrombotic, and insulin-resistant pathways, which you do see in many of the patient base, and in our patient base, again, the obese patient base. Let me give you a whole plethora of different things. Vitamin D, as we spoke about before, vitamin C, zinc, selenium, B vitamins, flavonoids, a great protein balance. Of course, once again, your resolvins, your vitamin E, L-arginine, folic acid, B6 and B12, omega-3 fatty acids again. So as you can see, you're going to see there's more than one. PEA is another great choice. Alpha-lipoic acid. Again, try not to eat a lot of sugar. A big takeaway with sugar is 300 calories of sugar in one time frame decreases your immune system by 50%. So I don't hear enough of the docs on TV who are doing a great job elucidating what needs to be done as far as helping yourself with the SARS-CoV-2 and COVID-19. They're just not talking about how much diet really plays a role in it. And last, we talked a lot about the symptomology of those two patients of mine, one that's going through COVID-19 right now and one's post-COVID-19. You have to understand there's a gut to lung to brain axis. And in that gut to lung to brain axis, your gut and your brain communicate, your gut and your lung communicate. It's sort of what I call a three-way calling. And because things that are damaging your gut damage your lung, and things that damage your lung can damage your brain, or any way within that triangle, it really leads you down a ruinous path towards poor health. So early phase COVID-19 has been shown to increase intestinal dysfunction, decreasing at the initial part, decreasing your incidence of acute respiratory distress syndrome, actually at the beginning decreasing inflammation, shocking as it may seem. However, it will cause dysbiosis in your gut. Ultimately, your progressive phase of COVID-19 at 3, 4, 5, 7-day period, you may not have the intestinal dysfunction, but you can have a tremendous increase in that acute respiratory disease syndrome and an increase in incidence of inflammation in the cytokine storm. One of the best things you can do to ameliorate the myriad of symptoms that come from this gut to lung to brain axis is simply take good care of your gut, keep it in its pristine conditions. Pre and probiotics are a great choice. So I hope everybody found this useful. I'm here and feel free to ask any questions. As everybody knows, my name is Dr. Rob Silverman. I'm always yours in health. Hope to hear from you soon.